Hi guys, and welcome back to the Black Health Academy, and welcome to another master class. This month I'm sitting down with Dr. Paul Thomas, who is the founder of Plum Health, based out of Detroit, Michigan. So as you guys know, one of the missions of the Black Health Academy is not only to educate you guys as the community and consumers, but we also want to initiate a extenuating education program and continuing education program for physicians as well. And our goal at the Black Health Academy is to essentially train physicians on how to treat specifically African-American patients who are based in urban communities, because we see a lot of health disparities just based on the difference between, the relationship between your physician, and sometimes a lot of people have complained about they don't feel comfortable with their physician. They feel like their physician doesn't know them, is not familiar with their culture. So one of our goals is to eventually have a space where physicians can come and learn directly how to treat certain demographics. So I'm sitting down with Dr. Paul Thomas, who has done a phenomenal job in our own community here in Detroit with rolling out a direct care program, which specifically caters to the inner city and these urban demographics that we are targeting. So I'm so excited to talk to you today, Dr. Thomas.
Thank you.
You and I met in an entrepreneurial program, I think a couple years ago now. Has it been about 2 years?
Almost 2 years, yeah, like a year and like 18 months.
Yes. And so I was starting my company then, my second company, and I remember asking you specifically about medical school and what medical school you went to. And then since that time, I've re-enrolled in Wayne State University pre-med.
That is so awesome.
Yeah, so I really want to thank you for kind of being a catalyst for that decision for me. And so I'm excited to deep dive today into your practice as a physician, kind of some of the things you see in your practice, and then Plum Health. So tell us a little bit about why you decided to become a physician in the first place.
Yeah, so, I grew up locally. I grew up in Grosse Pointe, and always been aware of the health disparities between the two communities. And when I was 17, I started volunteering at the Cass Clinic, which is on Cass Avenue in Midtown. And this was before Midtown was Midtown.
Yes.
And I got to take care of some really vulnerable populations, elderly folks who lived across the street, who had no transportation options, homeless folks who were making a paycheck but didn't have insurance, so uninsured or underinsured folks. And I got to work shoulder to shoulder with medical students, and then we had an attending physician who really could handle anything that came his way. And when I learned about family medicine, and I wanted to have the skill that doctor had, right? Who's able to take care of anything that might come his way. So that was my inspiration. And I've always wanted to give back in some way, being a part of the Wayne State community in medical school and living here during medical school. And I knew that I wanted to practice here as well.
Wow.
Just try to answer some of those health disparities that I've lived through my whole life, and just try to be a part of the solution.
Absolutely. And I think that's one of the main benefits of Wayne State Medical School, is that you do get exposed to the community more, with so many medical facilities being around the university. I think that's one of the pros. It's not just research and theory, but there's a lot of practical application just based on the environment we're in. And so it sounds like that had a huge impact on you.
Yeah, and in medical school, it even got more intensified, because we started a student-run free clinic when I was a first-year medical student at 555 Connor. It has 4 5s. It's a Mercy Primary Healthcare Center. And then on Saturday they have a clinic from 9 to noon. It's for uninsured folks only. So I did that during medical school, and then when I was a fourth year, a really go-getter second-year student started a street medicine Detroit program, where medical students did free medical care for homeless people in shelters and on street corners, and taking medicine directly to them.
Wow.
So I was in a write-up in the, I believe, Free Press about that. I was one of the fourth-year advisors for that program when it was getting started. So, programs like that, you not only have clinical, formal clinical experience at a hospital or clinics, but then you also have free clinic experience that you're not going to get in, let's say, Ann Arbor or Mount Pleasant, or wherever medical education might take place outside of Detroit.
Absolutely. So that's a really unique experience. And I imagine it really opened your eyes to kind of the chronic diseases, illnesses that a certain population suffers from versus another.
Right.
So what were kind of some of the differences you saw from treating homeless people, underinsured or uninsured populations versus a population that may be educationally and socioeconomically a higher status?
Yeah, there's just so many things from basic, just starting with like the basics, having toiletries or socks and underwear and things like that, to having a safe place to store someone's medication. Like if you have diabetes and you have to refrigerate insulin,
Absolutely.
It's going to be really difficult. And then just on an educational level, just making sure that our patients could read the labels that we put onto their medication bottles, and asking them, are you able to read? I don't mean to be rude,
Yes.
but I want to make sure that you know how to take this medication so that your health is optimized within like the context of our limitations here in this clinic.
Sure.
So like speaking to those health disparities and just not having toiletries, when I was a senior in high school, I did a sock drive at my church. So one of the saddest experience that I've had in medicine was, it was a very cold January day and somebody came in with frostbite and they were wearing the same socks that they'd been wearing for a couple weeks, and they had gotten wet and they never really got dry, and his foot was kind of macerated and had some black tissue and blue tissue just from the skin dying. And so I did a sock drive at my church, and that was one of the first times that clinic started stocking toiletries and socks and clothing items for the people that came through the clinic.
Wow. And so it sounds like you've been into community service and giving back and serving these populations for a while. And so that was kind of the catalyst to launch Plum Health.
Yeah, I mean, I've always known that I would do something different with my medical education and training, and Plum Health is just part of that iterative process where I'm just trying different things. I knew that I wouldn't really feel satisfied working for like a government agency like at a FQHC, and I knew that I didn't really want to be employed by a larger hospital system, so I was like, how can I stay true to myself and serve others, but do it in a way that's kind of like socially conscious and equitable and just and things like that.
Yeah, do you kind of feel like in medical school that is one of the battles that a lot of individuals face, who, those who are really going into it to really help, but then you come up against big pharma, corporation, and you've been, strong enough in your resolve to push past that and, go against the status quo. But do you feel like a lot of your, classmates decided to just follow the norm and sacrifice some of their core values?
Yeah, I wouldn't say sacrifice core values is a little strong, maybe compromise some of those core values.
Okay.
Might be like a little bit closer to it, but there are so many pressures. As you're looking, I'm sure as you're thinking about medical school, there's a huge debt burden that you have to take out, especially if you're out of state. So I graduated with $170,000 in student loan debt. And so the thing that I gave up on was a high salary coming out of residency. I could have made X amount of dollars, but I kind of gave up on that higher salary to start my dream practice, which is Plum Health. Whereas other students might have kids or might have families or might have parents that they have to take care of who are sick, and so it's really hard, and I do not blame any of my colleagues for any decisions that they make.
No, and you can make a huge difference. Like, I think it would be nice if more people with your ideology moved into those spaces, but stuck to the ideology, So because we need them. A lot of people get their medical care from traditional facilities. So if we could have individuals like yourself who are like, I care about my patients, I'll find a way to spend more time with my patients, even though I have to see hundreds. Like, we know all the barriers, So I'm with you. I'm not criticizing those to go the traditional route, because we need people in every area.
It's just it's a delicate balance, because we became doctors because we want to help people, and that's the driving purpose. But through medical school, you kind of get chipped away at in terms of your resolve and core values, like you're saying, and then you're left with sometimes a hard decision. And before this movement started, before direct primary care was an entity, I was kind of lost. You know, I really didn't know how it would kind of come out and be the doctor that I wanted to be. And I was fortunate to find this in the last years of my training and be able to make that decision. I really decided in the last 6 months of my training to do something completely different than what I had thought I would do initially.
Wow. Right. And so did you have a lot of resistance from family and friends, or was it a pretty smooth transition with a ton of support?
Yeah, my dad was kind of like, what the heck are you doing?
Right.
Because he grew up working on the assembly line, and so it's like he's really familiar with traditional benefits and like wouldn't really want to pay a dime over and above his traditional coverage. And I feel like a lot of people, especially in a blue collar town like Detroit, feel that way. So he was like kind of scratching his head like, you did all this and now you're not going to cash in on like what's going on with you. But and you know, there are people like that who have their questions like, how is this possibly going to work? But by and large, my family's been super supportive. My physician colleagues have been really supportive. I think they're really happy to see somebody who's able to pull this off successfully. Because it's the dream, right? You're a doctor, and then you actually get to use your skills as a doctor, and you actually have enough time to use those skills and enough time to learn about your patients.
Absolutely.
That's like, in my mind, that's a dream.
That's ideal. Absolutely. Right. So let's talk about a little bit about what Plum Health is, so people know what we mean about you kind of not going the status quo, because I think it's a phenomenal, you know, setup, business plan and service. Like literally, when you think about the word service, like literally, you have the opportunity to serve, build a rapport, build relationships, get to know families over time, and I think you've created that platform. And it's phenomenal just from an entrepreneurship standpoint, regardless of the industry. And so I'm really proud of you. Really I am. Because I remember you first explaining this in our class at Build Institute. And I'm like, yo, I've never heard of anything like that. So really courageous. It truly is. So what exactly is Plum Health and how does it work?
Yeah, so Plum Health is a membership model for healthcare. And so it starts at $10 a month for kids, and then young adults are $49 a month, and it goes up a little bit from there based on age. But for that membership amount, I'm your doctor, and I take that oath seriously. That's the core of it. Like, we're a team now, and as long as you're a member, you have my cell number. You can call me anytime. You can text me anytime. You can email me anytime. I guarantee same day or next day appointments in our office. And then let's say you're traveling and you forgot a medication, I can call it into the nearest pharmacy. I also coordinate wholesale medications, at-cost labs, at-cost imaging. And what that might look like, let's say you take a blood pressure medication called lisinopril, and it's $10 when you get it from the pharmacy. It actually costs less than 1 cent per pill. So I gave somebody 90 tablets of lisinopril, a 3-month supply, for 72 cents.
Wow.
2 days ago.
Wow.
And people want to come in and check their cholesterol. It's $6 to check your cholesterol. Versus if you had that done at the hospital, they bill your insurance like $150. It's, you know, we're trying to remove those cost barriers from care, and then we're also trying to make healthcare cost transparent.
That's a huge difference from the care standpoint all the way to the medications. And so you get the medications at wholesale and you essentially sell them for wholesale.
Yeah, exactly. I don't make any money on the medications. I only make money on the memberships.
On the membership. And So since you started, when did you start Plum Health?
I started in November 2016. So about 16 months.
Yeah, so in the 16 months since you launched Plum Health, how many members have you guys accrued?
Yeah, so we've signed up 350 people. We're currently at 250. You know, we just have attrition.
Yeah, of course.
Just like any other business. But, you know, 350 people have been interested enough to sign up, and then we currently have 250 members who are active.
Wow. And so how many doctors do you have on staff at Plum Health?
It's just me.
So how, Dr. Thomas, do you manage 250 members. I know everybody doesn't call every day, and
Right.
I imagine that there is a kind of a education, a kind of a space for the customer to understand that my doctor is available to me, because
Right.
I think traditionally we don't think our doctor's available, so it doesn't wrap in our head that I can call you more often. So I imagine a lot of people still kind of wait until it's like, okay, you need the doctor now, or
Sure.
because usually we don't look at our primary care physician as co-workers or co-passengers in our health.
Right.
We look
Right.
at you sometimes as emergency only. You're going to cost me money. So
Right.
now that it's affordable, has there been a huge learning curve that you've noticed for patients?
Some patients use it more than others.
Of
I
course.
think an average patient visits the doctor 2.7 times a year. And I think that the average patient in my practice might visit like 3 times a year.
Okay, so there's
So at like
very close.
Yeah, like 250. They say you're going to see about 1% of your patients each day when you're a doctor. So in my model, 250 members, that's 2.5 patient visits a day, which is about average.
Okay.
Right? So that's
Right.
totally manageable. And then
Right.
if you come in, I have an hour to spend with you, and then I might get 1 to 2 times as many phone calls or emails from patients each day as well. So then I have 2.5 phone calls or emails
Yeah.
to 5 phone calls or emails a day. So then I have the rest of my time to kind of handle that. And some people just ask like, hey, should I check my vitamin D? And I'll just look up the latest research and send them a little paragraph
Yeah.
like, hey, this is what the recent
I
stuff
love
on
it.
vitamin D is.
Yes.
Let me know if you want to go forward with the test, and we'll schedule a time.
Yeah, I can't imagine the comfort level that gives an individual, especially with a history of, just diseases and issues or whatever they may be dealing with. The level of comfort that would give someone, feeling like, wow, I really have a relationship with my doctor. He or she is really accessible to me. There's not a bunch of red tape barriers. I don't have to call and talk to a receptionist first, make an appointment,
Right.
call back, wait for a voicemail. It's not business hours, like all of the red tape.
We're closed for lunch.
Exactly,
Yeah,
exactly. And so that's truly amazing. And I imagine to scale this thing, you're going to need more physicians on staff, because
Yeah.
I've been seeing Plum Health popping up all over the airwaves and everything, and I imagine it's going to catch on quite nicely. What range of illnesses or conditions do you service?
Yeah, so as a family doc, my training is pretty broad. Scope of practice is broad. We say all ages and stages, and then virtually like probably 90% of your healthcare I'm comfortable caring for.
Okay.
And that could be like asthma, diabetes, eczema, gout, weight loss, nutrition, high blood pressure. I even like if you cut your hand, I want to sew it up for you. I try to replace your need for an urgent care, right?
Yes.
Because I'm on call. So I had a guy who put a drill into his hand on a Friday night at 9 o'clock. And so I met him here at 9:30, sewed it up, and then he was home by like 10:15.
I love it.
Right?
Yeah.
That's the level of service that I provide for my members.
Yes.
And I remove IUDs, I do PAP testing, I do abscess, incision, and drainage, so people get armpit abscesses or,
Yeah.
the unpleasant stuff that you don't want to talk about.
Of course.
If you have something like that, I remove warts, etc.
Yeah.
It goes on and on.
So, how often are you finding yourself having to refer out to a specialist?
Probably like maybe 1 in 25 concerns. Probably like every 5 people, I'll write up a consult.
Okay.
Every like 5 new concerns that people have, I'll write up a quick consult. I have this e-consult platform called Rubicon, and what I can have access to are 200 plus specialists, from like allergy to dermatology to endocrinology to cardiology and orthopedics, etc.
Cool. Yeah.
So for like one of my patients, she was suffering with ankle pain for a long time. So we got an x-ray and it showed like a little nodule on her ankle bone. And then we got an MRI and showed a little bit in greater detail about that nodule. So I took those images and I wrote a consult to an orthopedist through the e-consult platform, and we got a second opinion. And his recommendation was, this one's going to need surgery. Otherwise, it's like you're going to be rolling over a pothole every day.
Wow.
And so, that's where that platform becomes really helpful.
Yes.
And then somebody has a new skin lesion. I think it's eczema, but let me take a photo of it and send it to the dermatologist for a second opinion. It doesn't cost you any money.
Yeah.
And we have that at our disposal. So
Right.
that's how I can kind of extend my scope a little bit further than the typical primary care doctor, because I have the time to sit down, think about the case, and write up the consult.
I love it. And what feedback have you been getting from members? Like, are they just like, I can't believe this is available. Thank you. I mean, I can only imagine the level of gratitude. Like you said, a late night on a weekend, all of a sudden my child is coughing or turning red or anything, and that you're just, they're like, I mean, there's urgent cares and everything, but just knowing that I have direct access to my physician, and like I said earlier, we're co-workers in this thing, and I don't feel like it's a matter of I'm just being told what to do or being blown off, but you really, care. And so has the feedback from patients been really rewarding?
Yeah, I mean, I get a lot of thank you text messages.
Yeah.
And then, like, as a business owner, I'm like, well, if you write that on Google, that's really helpful
That'll
for
be
me.
dope, right?
Yeah. So, we do have a lot of really great Google reviews and Facebook reviews and Healthgrades reviews.
Good.
And, it's nice to see that feedback. But, like, even more powerful than that, we had a lady come in this morning for a recheck of her blood pressure and a med refill. I refilled atorvastatin, lisinopril, hydrochlorothiazide, a cholesterol medication, and 2 blood pressure medications for $12 for a 3-month supply.
Wow.
Right, and she, got teary-eyed in the office because before meeting us and before having the service, she was going without or paying really high prices when she could afford it. And this is somebody that's kind of like living paycheck to paycheck.
Yeah, of course.
On a fixed income. So it's like these cost savings are really impactful for people. And not that I need every patient of mine to cry in front of me, but it's like that's where I know, like, this is where I'm supposed to be. This is exactly what I'm supposed to be doing. It's the purpose and the passion that I have for it that makes us all kind of worthwhile.
Absolutely. And I mean, just as humans, we require that validation. We all do.
Yeah,
and so
it's nice.
It's nice. I mean, some of us more than others, but it's really nice to know that I'm making a difference, and someone's life is being significantly impacted by my work. So I imagine that's really cool. So let's talk a little bit kind of about the trends that you see, particularly in the African-American community, because, the top 3 killers in the African-American community are heart disease, cancer, and stroke. Completely preventable, luxury diseases, what they consider diseases of the affluent. And so I like to know, from your perspective and your experience, is that typically what you see? A lot of obesity-related illnesses, hypertension, diabetes, and things that essentially are lifestyle diseases.
Yeah, yes, 100% yes. And this is, Detroit is a league leader, so to speak, in all the wrong categories, right?
Yes.
We're really bad for high blood pressure, diabetes, cancer rates, infant mortality rates.
Yes.
And there are a lot of racial disparities. I know you can't see this on, maybe you can link this. This is from Michigan.gov. It's a 2009 Health Disparities in Michigan report. And some of these are just horrifying, just like the infant mortality rate, especially 16.5 in the Black community versus 5.8 in the white community.
Yep, and that used to be 11.5 in the Black community. It's went up. Last time I checked. Wow, I didn't even know that it went up.
I think this has improved somewhat in the most recent data sets.
That was 2009, right?
Yeah, this is 2009.
I think mine was a little more recent, so it might be down to 11, but it's still over 100 times more than our Caucasian counterparts.
It's horrible. Yeah, I mean, it's horrible. And how can we work to erase these health disparities?
Yes. And so, what would you attribute it to mostly?
There's just so many factors. And this is why it's so hard to tackle. But we have to start with education and how we educate our children in elementary schools. And Detroit especially has a hard time with that because of all the complexities around Detroit public schools and underfunding and charter schools coming in and all of these issues around education. But if we could educate our kids about the importance of getting an hour of exercise, getting 5 fruits and vegetables each day, reducing your screen time, having no pop or added sugars in your diet.
Yes.
Those things could be tremendously impactful just going forward in aggregate. The second thing we need to work on is healthy places and healthy spaces. Detroit is in tough shape because we don't invest in our public parks and we don't invest in safe routes on getting people from the neighborhoods to public spaces. I think Detroit is doing a little bit better. They're talking about the extending some of the greenways up from the riverfront and drawing people in to, let's say, the river walk and the DeQuinder Cut, etc. I think those are really crucial. How do we get more kids to be able to walk to safe places to play and exercise?
Yes.
And then,
crucial. And
then, just how do we have more access points for healthcare services? Community health workers, doctors like myself, kind of working in. I'm pointing to a large window out here. Community-facing healthcare facilities where people from the community have a safe place to walk or take the bus to and see a doctor or a nurse practitioner or PA who can work with them on a human level about helping them with their high blood pressure or diabetes, going through their cholesterol results and trying to bring down the risk factors for heart attacks and strokes.
Right. So how do you feel about one of my biggest issues with a lot of primary care, especially in our own backyard, is the fact that they see the same thing so much that they make assumptions, but as opposed to really doing a full, extensive, examination and health and lifestyle history and behaviors. I can recall going to a physician. It's maybe been almost 2 years now, and he was right in downtown Detroit. I believe he was Indian. And I came in, all I wanted was a referral for a dermatologist because I was breaking out and I wanted to know why. It turns out it's because I was just detoxing when I went vegan. But I thought I was allergic to wool. So I'm like, hey, I need to see a dermatologist. And he, of course, had to do the basics first, though. Blood pressure, everything. But the nurse did that. And then by the time he came in the room, he looked at my chart and he looked at me. He said, no high blood pressure? And I couldn't believe he said that. Okay. I can understand thinking it, like, because I imagine he sees it all day in and out. Yeah. But he was genuinely shocked. He's like, you're a healthy weight and you don't have high blood pressure, and you're like, and so all I imagined happening was him walking into a room on a normal day, seeing, a black woman or man that was overweight, and then went from there and made all these wonderful assumptions, right? And so I imagine that happens more often than it needs to, or that it should. Not to say most of those things are not present, because we are really leading the pack in those things. So, but that impacts healthcare, and so what's your take on that?
Yeah, well, first, I'm sorry that happened.
No,
sincerely. I think physicians have lost their trust with, just globally. You hear things about like Larry Nassar or the woman who was engaged in genital mutilation. I think the point I'm trying to make is that trust in physicians and health professionals has been eroding over time. And I think because doctors have less and less time to spend with their patients and really get to know them, you have more and more assumptions, and then you kind of lose trust with people who are making assumptions about your health and your body and who you are and your habits, etc. I avoid those. I have the luxury of having more time. That's kind of built into the model.
Absolutely.
And that's where this model works really well, is we get to sit down and I get to ask you, what's your diet like? And tell me about your exercise regimen in kind of an open-ended way, and we can have a genuine conversation about that.
Absolutely.
And then we can go forward with that knowledge and make some really tailored health recommendations. Versus just saying something that's not accurate.
Right. Really insensitive, and so I appreciate that, and I can't thank you enough for it, because I think it's really important, because especially someone who is a lower socioeconomic status, maybe, you know, partly illiterate, and they get in front of a physician because just like in law enforcement or, you know, in the political justice system, we put these individuals on pedestals. We put you guys on a pedestal. And so a lot of times, if you're not confident, or up to this point, if you haven't taken or played a major role in your own healthcare and you relied on other people to tell you what to do, you're extremely intimidated and you don't challenge anything, right? And you definitely don't go and research the medication that you're prescribed, right? Most people don't know that metformin has a black box warning from the FDA, for example. And so we typically just take what you guys say, whether it's a judge, a lawyer, or a doctor. And so I think it's really important that that we create, as physicians and healthcare practitioners, or, you know, nutritionists, that we create a safe space and help to disarm the public about, hey, we're doing this together. This is not me telling you, don't eat this, don't do this, go exercise. This is me kind of digging deep into your life and seeing what's going on. Because a lot of it, what I find with our clients over at Professionally Fit, is it starts psychological, right? And so they're harboring things from, you know, childhood or bad relationships or whatever, and that translates to some really unhealthy lifestyle habits. And so it's great when a doctor doesn't just put a medication on it, you know, or dismiss them as just lose weight and you'll be healthy. Well, that's it's deeper than that. Right? And so I don't know, what's your take on that?
Yeah, like I try to ask about family history and really understand what, you know, if it's a new diagnosis of high blood pressure, let's say, usually that takes a couple readings over a couple visits to establish that, versus saying after one reading, oh, you definitely have high blood pressure, let's start a medication. I like to understand somebody's story arc, if you will. Like, did you just have a stressful experience at work? Rough drive-in? Like, what's going on? Or, you know, some people have what we call, you know, white coat hypertension, where they get in to see the doctor and their blood pressure might be elevated
from the environment alone.
So how can we get you either a blood pressure cuff that you take home, or can you stop in at a Rite Aid and throw your arm in the thing and write that down, or text it to me so I can keep a log of it for you, and then we can kind of look at those two numbers next to each other at the next visit and make a determination. And that might be, like, if you're borderline, I might say, this is your opportunity to make a decision. Do you want to change your diet, exercise more, or do you want to try a medication? And there's no wrong answer, but that's an opportunity for us, you know, doctor-patient, to engage in that shared decision making. And that's, like, very valuable, because then you get to learn what people value. And a lot of people choose that I want to try to make some changes first, so we'll do a 3-month trial, and if it ain't working, then we'll try to go for some medication.
I like that. So come up with a plan of action and tweak it and adjust it along the way, as opposed to saying this is your plan, but kind of co-produce it. Versus being prescriptive and telling people what to do. It's engaging them and finding out what they value and how they want to manage their health. Yes, that's amazing. I love the, you know, the built-in bedside manner and the availability to build a rapport and a relationship with clients. Let's finish off talking a little bit about these lifestyle recommendations versus medication recommendations. And I know you said there is no bad answer. Do you kind of lead towards, hey, ideally medication is supposed to be temporary as you transition into doing some of the things that will fully reverse this illness?
Yeah, so I mean, everybody's different. Some people just have high cholesterol due to genetic, and based on guidelines, they may require a statin. Or somebody might have an adrenal problem, or a problem with the hormones that they make, where their blood pressure is just sky high, no matter what they do. So, you know, in those cases, you know, sometimes it's like, listen, it's going to be really difficult to lower this without medication, and for your safety, we should do these things. And that's not to discourage anybody from exercising or changing their diet, just to be, in a holistic sense, more healthy. And who knows, after years of diet changes and exercise, their blood pressure may drop to where they may not need that medication anymore. So I am a Western trained doc. I did go to a Western medical school. I do have an MD.
Yeah.
So I am comfortable using medications to help people because there is value there. But I also love working with people and seeing people change. I'm going to tell you a story about a chef that I work with.
Okay.
It's popular chef locally who just wanted to lose weight, wanted to lower his cholesterol, had some body issues and some function issues that he was not happy about. And so we talked and did the blood work and found his markers to be high and his blood pressure to be high. And he took it upon himself to try a vegan diet and increase his exercise to more of a daily routine versus something that he would get to every once in a while. He dropped his blood pressure by 20 points.
In what span of time? Do you remember?
6 weeks.
Wow.
It's like a little over a month. So he dropped his blood pressure by 20 points. He dropped his cholesterol level. I'd have to look at it, but it was a pretty sizable, significant drop.
Wow.
And this is 6 weeks in. And it's like, okay, let's do this for another 6 weeks. See where
we
you're
get, right?
and see how far you can get on your own.
Exactly.
And if at the end of this period you don't have to go on a medication, that's awesome. That's awesome for you. That's awesome for me.
Absolutely.
You have less risk when you don't have to take a medication.
That's right.
And then you have that satisfaction as like, I did this myself.
Yes, that's a huge satisfaction.
What I tell people is, especially with weight loss, for some people it took them years, sometimes decades to get to where they are, and it's not going to happen overnight, and you can't expect that to happen.
Exactly.
I share that story because it's remarkable, but that's not realistic for everybody. Sometimes it might take 2, 3, 5, even 10 years to get to where you want to be, but I can work with you and help you get there, in an appropriate timeline.
Absolutely. I love it. Well, I appreciate that. I appreciate you being completely neutral with regard to what path individuals want to take and being really supportive either way and not leaning more based on your own personal beliefs or ideologies, because that also creates a lot of disparities, just people being really opinionated and feeling like this is the only way to do this thing. I've had so many clients tell me, oh no, my doctor said the only way to get my iron up is to eat red meat. And I'm like, I don't think that's the only way.
It's not accurate.
Right? So I appreciate that you are, still inundating yourself with research, which is super important, and getting the patients involved and sending that to them, and again being co-workers as opposed to a dictator in this field, because it's health is all we have essentially. You can't do anything without it, and so it really feels good to know that you have someone on your team who is just committed to your own health as you are. So thank you. So Dr. Thomas, why don't you tell everyone how they can enroll in Plum Health if they would like to. Again, guys, I know some of you in the academy are not based in Michigan, but are you guys planning for expanding?
Well, there's direct primary care practices all over the country.
Okay.
We say a rising tide helps all ships.
Okay.
So if people want to find a DPC doctor across the country, I can clue them in. Just drop me a little line and I'll send you an email with the closest doc to you.
Okay, awesome. So below here in the academy, guys, of course, I'm going to put Dr. Thomas, all of his information, the information about Plum Health. And so you can reach out to him even if you're not in the Detroit area. Again, he said he'll be more than happy to help you out with resources where you can find direct primary care in your own area. Okay, Dr. Thomas, so tell people how they can enroll in Plum Health, get in touch with you, and some tips for maintaining great health.
Yeah, so if you need to get in touch with me, here's my cell number, 313-444-5630. If you have questions that you want to talk to me about, happy to help you. You can also go to our website. We're plumhealthdpc.com, and the DPC is for direct primary care. And we're on all the socials at that as well, Instagram, LinkedIn, Facebook, Google+, Plum Health DPC, YouTube. We got the YouTube channel.
All right.
So, you can't miss me online.
Good.
And then some tips for being healthier. Take time for your health. That's the biggest tip, is like taking time for yourself. And that might be taking an extra hour to prepare a meal for yourself, or taking an hour to go to the gym, or taking an hour to meditate, or taking an hour to do something fun with your family that's healthy in a different way than what we might think of as health.
Absolutely.
There's so many ways to be healthy. It might be organizing a group in your community to pick up trash at your neighborhood dumping lot.
Yes.
You know, or planning a fun event for your family, or going to the gym, or cooking, or whatever it may be. You got to take time for yourself.
Absolutely.
And don't forget how valuable your health is. Like Lisa said, your health is what you have, and if you don't take care of yourself as you age, you might not be there for your kids, or you might not be there for an aging parent. You know, you gotta take time for yourself.
Absolutely. I appreciate you so much, Dr. Thomas. Thank you for sitting down with us today.
Thank you.
And guys, again, all of his information will be available inside the Black Health Academy, so you can definitely reach out. And remember, we'll be back here next month with another master class. Until then, begin to remember to tell at least 10 people. Talk to you soon. Bye, guys.